Hello, guys. So, today we'll be talking about vaginal yeast infection. We'll be discussing very vital and sensitive topic today, which is vaginal yeast infection. What are the causes of vaginal yeast infection? What are the signs and symptoms of vaginal yeast infection? What are the treatments of vaginal yeast infection? And even the preventive measures of vaginal yeast infection. So welcome back to this channel. If you are a newcomer to this channel, maybe this is your first time of coming across this channel, please do well to like this video and then subscribe to join the group. All right, so without wasting much of your time, I am still Ruth Kings. In this channel, I talk about everything health, especially reproductive and sexual health. So without wasting much of your time, let's dive into the main topic of today, which is vaginal yeast infection. But what is vaginal yeast infection? Vaginal yeast infection is caused by a fungus known as the candida. This candida, vaginal candida, can also be called vaginal thrush. It can also be called vulvovaginal candidiasis. It can also be called candida vaginitis. So these are the other names you can call this vaginal candida. And this candidiasis result come to play as a result of the effect or damage that's been done to the normal flora bacteria that exist in the vagina, which help to keep the pH and then keep the surrounding of the vagina in check, fighting against other bacteria, other infections, other fungus that shouldn't exist in the vagina. Whenever this normal flora bacteria is tampered with, it then subdues and suppresses the effect of it, thereby letting loose the ability of other, because this fungus may be existing in the vagina, but because of the effect and the power of this normal flora bacteria, it will not allow it to overgrow. But when the power of this normal flora bacteria is tampered with, the fungus will now accumulate, will now get enough strength, to subdue, to overgrow, and then cause what is called vaginal yeast infection. So what are the signs of this vaginal yeast infection? The number one sign that you will see or symptom is itching. You you will feel so irritated. There is this kind of irritation that you always feel, which will cause itching down there in your vulva and even and even at the tip of the vagina. So you always feel this itching sensation. Another sign is that you will feel this intense burning sensation. But whenever you feel all these things, don't just declare that it is vaginal yeast infection. Make sure you go to the hospital, get yourself checked first, to know what is exactly happening to you, because there are other conditions that can have the same symptoms. Okay, so the next symptom is inflammation, which will lead to the next symptom. Inflammation will lead to the next symptom that I will mention now, which is um painful sexual intercourse. Whenever you're having sexual intercourse, you feel pain. Why? Because of the inflammation. Inflammation means sore. There is sore in the vagina or around the vulva. So whenever you feel these things, you will know that something is already wrong down there. Go get yourself checked so that you know the treatment to face immediately. So the next symptom is redness around the vulva area. That place can be so red, because of the activities of this fungus. It can cause that area, the vulva area, to be very reddish in color. Another one is this awful kind of whitish discharge that comes with this kind foul smell, very disgusting kind of smell. So when you see all these things, they are signs and symptoms of vaginal yeast infection, rush to the hospital and get yourself checked. So what are the forms of this candidiasis? Number one, we have the cutaneous candidiasis. Cutaneous candidiasis is the one that occurs at the superficial areas of the skin. They are called the cutaneous candidiasis. So the next form of this candidiasis is what we called systemic candidiasis. Systemic candidiasis simply means the one that have entered the bloodstream, the one that have affected the bloodstream. So the next form is gastrointestinal candidiasis. Gastrointestinal candidiasis is the one that happens along the gastrointestinal tract. The gastrointestinal tract, your esophagus down to the stomach, the small intestine, large intestine. They are called the gastrointestinal candidiasis. So another form of candidiasis is the oral candidiasis. Then the last but not the least is the one we are discussing today, which is the vaginal candidiasis. The vaginal candidiasis is the one that occurs at the vagina, which is the one we are talking about in this video. So what are the risk factors of this candidiasis? What are the things that can cause this vaginal candidiasis? Number one is uncontrolled diabetes. The second one is pregnancy. The third one, if I look down, I jotted it out here, so don't be worried about that. The next one is antibiotics. Too much of antibiotics causes this candidiasis, especially the vaginal candidiasis. Then oral contraceptive pill. Too much of oral contraceptive pills causes candidiasis. Multiple sexual partner, when you have more than one partner, when you just have sexual intercourse with anybody you see, with strangers, with just anybody you come across with, is a risk factor. Another one is immune compromise. Maybe when the immune is affected by HIV and AIDS, or being a an SS blood group person is also a risk factor to this condition. So how do you find out the exact condition, the exact infection that you are suffering from? How you find out is by conducting what is called high vaginal swab. This is the only diagnostic analysis that will help you to find out that, okay, what is actually happening to me is vaginal candidiasis, because there are other kind of conditions that can have the same signs and symptoms. But when you go through this high vaginal swab, you'll be able to identify the particular one that is happening to you. So what are the differential diagnosis? Differential diagnosis simply means what are the other conditions that may display the same kind of signs and symptoms? What are the other conditions? What are the other diseases that when you have them, you may still have the same kind of symptoms? Okay, number one is chlamydia. When you have chlamydia, you may tend to have the same symptoms and signs. Another one is gonorrhea. Gonorrhea have the same signs. Another one is bacterial vaginosis. These are the three differential diagnoses of vaginal candidiasis. So what are the treatment options? The treatment option is the use of antifungal treatment. It can be antifungal drugs or antifungal vaginal cream. The antifungal vaginal cream is the one that you can use to rub at the vulva area, whereas the drug is the one that you can take orally. For example, fluconazole. Disclaimer: please don't prescribe this drug for yourself. The ones I mentioned, please don't prescribe them for yourself. Make sure you are taking them from make sure you are taking them as the doctor prescribed. Don't self-prescribe them for yourself to avoid after effect of these drugs. And also, if you are pregnant and you find out that you actually have this vaginal yeast infection, please don't use these drugs. Maybe until when you put to bed, you cannot go ahead to treat them, and must be under prescription, under supervision by a doctor or your gynecologist or your midwife. Don't self-prescribe. I know why I'm putting out this warning. So, what are the preventive measures of this vaginal thrush infection or vaginal yeast infection? Number one is stop douching. If you want to prevent it, stop douching. I don't know why people doubt. When you doubt, you will distort the pH of the vagina, therefore helping this fungi to grow. You're reducing the ability of the normal floral bacteria to function. And when heat power is subdued, all these other ones will grow, overgrow self, and cause other damages or diseases to you. Please stop doubting for any reason. Stop it. The next one is stop wearing underwears. Underwears help to is a bleeding place for this fungus. Please stop wearing any wet underwear. Another one is tight underwear. Please wear underwear that can still give you space, that air can still, get to your skin, get to your body. Don't wear an underwear that is too tight. The next one is reduce sugar intake. Sugar, what sugar does is that it will help this fungus to grow faster. Like, it's their best food. They grow very fast in an area where there is excess sugar. So reduce your sugar intake. Another one is reduce your antibiotics intake. Reduce the way, not any small thing you rush to the pharmacist and get antibiotics and take. Small headache, you have already taken antibiotics. Small pain, you have already taken without prescription. Reduce the way you take antibiotics. It can also cause vaginal thrush. The next one is reduce the number of sex partners that you have. Don't just see anybody anywhere and then you involve yourself with the person in any kind of close intimacy, like sexual intercourse. Reduce the number of sex partners that you have. Maybe if you're not married, maybe you can just get married and save yourself the stress. The next one is stop washing your vagina with soap or detergent. If you want to wash your private part, just wash the vulva. Washing even the vulva does not require soap. You can just wash it with room temperature water. You know, the vagina is self-cleansing. It can take care of itself. So stop washing it with whatever kind of detergent that you think or feel it will, keep it neat. It's self-cleansing. So this is the end of today's topic. If you have not subscribed yet, please subscribe. Give this video a thumbs up, most importantly. Okay, bye bye.